Welcome to Ginny's, where East meets West, and a slice of Eastern philosophy becomes a part of Western thinking. I'm your host, Ginny Gong. My first guest is someone who has a distinct passion for serving the older adult population and decades of experience interacting with seniors. Having grown up in an intergenerational household and then employed in a field that provides support for the aging, this public health professional knows a thing or two about what it takes to keep families connected and a community grounded. She is the author of a new book entitled The Value of Wrinkles, a young perspective on how loving the old will change your life. Join me in welcoming Isabel Tom. Welcome, Isabel.
Hi, thanks for having me.
Well, let's talk about growing up in an intergenerational household. What was it like? Was this something that your family did out of necessity or just choice?
Well, I think my grandparents were around when I was born, and they were in Hong Kong, and so my dad wanted to have them closer by, and so I think it was by choice, but also, naturally, he wanted his aging parents to be closer by so that he could care for them.
So they immigrated here?
Yes, they came over here after my parents got married.
Okay, so you've been with them your whole life.
Yeah, that's why I tell people that I have over 35 years of experience with older adults because they were there before I was born. And my grandma was my last living grandparent, and she lived till 102, so I was 35.
Wow. And this is your paternal grandparents,
Paternal
right?
grandparents,
Right,
yes.
so very steeped in Chinese culture, right? The son is taking care of his parents.
Absolutely, he's
And
the
both
oldest.
of them?
Both of them, so.
Now, when you actually look at Asian American households, this living situation with all the different generations is really not all that unique, is it?
No, it's not that unique. I think what was unique is that I lived at home for a long time, and then they lived for a really long time. So my grandpa passed away at 98, and like I was saying, my grandma at 102. So
Yeah.
I was with them for a long time.
Well, I think what is unique in this country that is taking place. I know in China, it's assumed, right? It's assumed that when you get older, your son is going to take care of you. But here, it's not an assumption that you can really go with, right? I actually have to think back. My parents bought a house so that, there would be one apartment my brother would live in, one that I would live in, and one that they would live in. And the reality is, we didn't live there, and only my parents lived there. But in your family, that actually did happen.
Well, my grandparents came over to the U.S. first, and they had a stint where they lived on their own. And then it wasn't very successful, let's just say. And so both of my parents agreed that they wanted to have my grandparents live with them, and that it would be easier and better for them.
Now, what about your mother's parents?
So they passed away when I was fairly young.
Oh, okay.
And I think that's the case for a lot of my friends who are Asian American. They may have lived with their grandparents, but their grandparents passed away fairly early. So
I see. Now, in your book, you refer to it takes a village to care for an older adult. What do you mean by that? Because certainly we use that in reference to a child.
yeah, so I have 3 kids, and I definitely believe it takes a village to raise a child. But I think sometimes we forget that for an older adult, they also need a village to surround them with love. So I really believe for an older adult to get good quality care, they need a village.
And what might that village be comprised of?
I think it starts with family, and I think the more people that are there, the better. But everybody has different gifts. So everybody can serve the older person, the grandparent or parent differently. And then I would say you can include professionals, the community. And so I think as a community, sometimes we think that it is just, the family's job to take care of the older generation. But I think if we have an older neighbor, if we have an older coworker, we can all join a village in some ways and just bless them as they are nearing the end of
So
life.
here's the challenge. Do your, growing up in this intergenerational home, did your grandparents speak English?
So my my grandparents were from Hong Kong.
Okay.
And so my grandpa, he had British English. He could speak English fairly
okay.
well. So
Okay.
he was able to get around and do a lot of things independently. My grandma, on the other hand, didn't have that type of education. And so she spoke all Chinese, all Cantonese. And I would say that's probably why when I went to Chinese school, I was one of the few people in my class who actually had to use it when I came home. So.
Right, because you had to speak to them.
Absolutely.
Now, how about your children? Do they speak Chinese?
So that's hard because if they know, if your kids know that you can speak English, then they're just going to pop out the English all the time. So I try to use Cantonese, but it can be a challenge, especially when they go to school, I would say.
Yeah, in growing up, my children could never speak to my mother or father because they only spoke Chinese and mine did not speak Chinese, and I had to be the interpreter. Now that was different with their paternal grandmother because she spoke English and therefore they had a different kind of relationship. So I was just wondering, how challenging is it, when you have generations that can't communicate?
I think for me, because I lived with them for such a long time, I grew up, in the United States, and so I started speaking Chinese, but then quickly started using English. And for me, because I was close with my grandparents, I actually was motivated to learn more Chinese. So I studied abroad in Hong Kong for a year to improve my Chinese so that I could, communicate better with them.
Now, there are many things about getting old that scare us. What do you think is at the root of some of these fears? Because obviously you work with the senior population, you live, on a daily basis with them. Why are we scared about growing old?
I think it comes down to this, that we think that the older that we get, the less valuable, the less beautiful, attractive, the less capable that we are.
That actually is true,
Yeah, I think, you have to look at it different ways.
I mean, in Asian culture, age is respected.
Yeah, and I think the thing that I've learned is, I've worked with older adults personally, but also professionally, all the way up to, over 100. And there are a lot of ways that older adults contribute. It's just not the typical way. So,
So in your job, what is it that you actually do with this population?
So throughout my career, I have worked in actually every level of care, so independent living, assisted living, skilled nursing, short-term rehab, and then the last 8 or 9 years, I worked in hospice care at Montgomery Hospice. So, and then I spent a year writing this book. So I have kind of crossed all the various levels of care, but for me, in every job that I had, it matched where my family was at. So I was really paying attention because I wanted to help my family. Everything from when I worked in senior fitness, I was learning all the exercises and sharing them with my grandparents when I came home. But when I worked in hospice care, I was learning about the signs and symptoms of the end of life, and I was able to recognize those in my own family members. And it was hard, but it was really helpful.
How do you deal with working in hospice care? Because as we all know, in the Asian American family, we don't want to talk about that, right? It's very hard to talk to our Asian parents about the possibility of planning, of no longer being here. How do you deal with that?
Well, working in the end-of-life care field has taught me a lot, and it has taught me that when you spend time with people and you have a relationship with them, even if they're not willing to talk about it, you end up learning what their values are. And then a lot of times in Asian families too, your family members, they look to their family, especially the oldest child, to make those decisions for them. And if you know them well, number one, they trust you. So they trust you to make those hard decisions, but you also understand them. And so when you are put in that situation where you have to make those decisions, you know what they want.
Right. And usually in our families, we don't discuss those decisions until
you have to.
You have to do it, right? There's
absolutely.
none of this, let's sit down and talk about, what our plans are.
Absolutely.
Wow. You use the word shame in your book quite often. Why is it that many of us are ashamed of our age instead of, acknowledging it? I always tell people how old I am. You know, I'm very proud to have lived that long, but that's not the case.
Well, I think, number one, the media and society kind of feeds this message into our brains, and it's very ingrained that getting older, like I was saying, you know, you're kind of useless by a certain age is the way that media and society portrays that. I mean, just listen to the ways that we use the word old. You know, I hear my peers using the word and they say, I'm getting old, and they never mean it as a good thing, right? And I've worked with a lot of older adults, and they'll tell me their advice is don't get old. And then, you know, a lot of them will say, you don't want to hang out with an old guy like me. And so they're ashamed of it, but they're in that stage. And so for me, I think when you look at older adults and see their value, then you see that there's no reason to be ashamed.
So what is it that we can do to make the elderly in our lives feel more valued?
I think we value them the same way you value anybody else. So you acknowledge them, you listen to them, you advocate for them, you know, you listen to their stories, you care for them, and ultimately I just boil it down to the term a send-off. You give them a proper send-off, and that's different for every single person, but you can do it in those very simple ways by just spending time with them and caring for them.
Well, as we get older, many of us become very difficult to be around, okay? I think that's just a natural thing. What's your advice on how to love and care for those of us who become more cantankerous?
I think, you know, that's the number one question I get actually is, you know, how do you deal with a difficult older person? And I would say you kind of have to step back and you have to realize what they've gone through and what they are going through. So there's a number of different things, you know, just from the surface that you could look at. Number one, think about how much loss they've gone through.
Yeah.
If you knew somebody who was younger who experienced the loss of a brother, sister, mother, father, you know, and a spouse all within 5 years or 10 years, you would have a lot more compassion on them. And then just think of the loss in terms of the physical decline, not being able to hear as well. So that causes them to be more isolated, you know, not being able to engage in those hobbies and things they really always enjoyed. So there's a lot involved in aging that sometimes I think we need to just step back and just reflect on it.
Well, Isabel, thank you so much for all that you do for our older adult population. Keep it up, and good luck with you on your book.
Thank you so much.
Thanks
for having me.
It's time for us to take a short break. We'll be right back. Stay tuned.
Packers.
Viking.
Packers.
Viking.
Viking.
Red state, blue state, vegan,
Carnivore.
We come from different places.
Uptown.
downtown.
Optimist.
We come to different conclusions.
Half empty.
Half full.
But when we live united, we create real, lasting change in the building blocks of life. The education, income, and health of our communities,
Live.
our families,
United.
even the person next to us.
Live united.
Real change won't happen without you. So give, advocate, volunteer, live united. Sign up at liveunited.org.
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 110. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
If you drive buzzed, it could cost you around $10,000. You'll face major legal fees, major fines, and steep insurance penalties. You could lose everything. Nothing kills a buzz like getting pulled over for buzz driving, because buzz driving is drunk driving.
Welcome back to Ginny's, where East meets West. An outbreak of the coronavirus, which originated in the city of Wuhan, China in December of 2019, has been devastating. As of mid-March of 2020, there are over 127,000 confirmed cases, including over 5,000 deaths. While mainland China accounts for a large majority of the total cases, 44,000 of them have been outside of China itself. What has been just as troubling has been the xenophobic comments and actions of the media and the general public towards Chinese Americans. Chinese restaurant and retail owners are bleeding financially with the remarkable decline in customers as fear about the viral outbreak from China spreads. Advocates for the Chinese American community report significant increases in xenophobic comments and racist phone calls. Here to join us today is the Clinical Associate Professor of Medicine at Rutgers Robert Wood Johnson Medical School. Please welcome Dr. Victor Sloan. Welcome, Victor.
Thanks for having me.
Well, first, I want to thank you for filling in. My scheduled guest was not able to join us because this is an example of how the coronavirus has hit my show. And so, unfortunately, you happen to be here and you're very knowledgeable about the topic, so thank you for joining me.
My pleasure.
Let's begin with a better understanding of what this virus is. I know there is a lot of information out there. Can you synthesize it for us?
I'll try. Coronaviruses are very common. Many coronaviruses cause the common cold. We've had a couple of examples in the past, less severe. SARS and MERS are also coronaviruses. So this is just a very common virus, but unfortunately it seems to be much more severe, especially in people at higher risk, older people with other comorbid medical conditions.
Right.
And although we're still getting the numbers together, it seems like the fatality rate is much higher than similar viruses.
It somehow seems to be sparing our younger generation, right?
Well,
or is
it's
that
not that it spares the younger generation, it's just that the spectrum of how it affects patients is very broad. Many people have what might be seen as a mild case of the flu or a bad cold. The older you are, the more other medical conditions you have,
Right.
the more likely you are to have a serious or even fatal manifestation of the disease.
So let's talk about other viruses that have had an impact on us. You know, we've had the Ebola virus, we've had, 1918, the Spanish
The
flu.
influenza pandemic.
Yeah, the pandemic. How has the fears of those viruses compare with what we're dealing with now?
Well, as you mentioned in your introduction, I think one of the challenges is that Asians are often seen as other. My wife is Chinese American and
Yeah, let's talk about your family and you know,
born in the
why you're-
U.S.,
yeah.
but yet I lost count of the number of times people say, "Where are you from? Where'd you learn to speak English so well?"
Right.
Well, I was born in New York.
Yeah.
The other issue is that with this particular virus, you know, when the Spanish flu pandemic happened, we couldn't hop on a plane in China and 14 hours later be in the United States.
Yeah, right.
Ebola is a much more serious virus with a much higher fatality rate, but the transportation, the interchange of people between Africa and the rest of the world is much less than it is between Asia and the rest of the world.
And also the Ebola, you know, you could actually see more profound symptoms. Am I correct? I mean,
Absolutely.
Right. So you couldn't be walking around and have that.
Well, in the early stages, it's certainly possible, but as you're absolutely correct, coronavirus can be, we believe, asymptomatic. And so people, there's a 14-day incubation period when they may not know they have it, but they can still spread it.
And this is why it's more frightening than our, you know, annual flus that come around at this time of the year.
Look, we've had 18,000 deaths from the flu so far this season, but we've had 20-something million cases, so the fatality rate is much lower, even though the absolute number of deaths is higher, and that's just in the U.S.
Now, I know that you've been monitoring the medical impact of this virus, as well as the financial impact and the social impact on the Asian American community. You have a personal interest in it. You know, your wife is Chinese. You have Chinese daughters. Let's talk about the consequences of this human behavior that's predicated by fear.
Well, it's pretty clear that if you talk to reputable public health experts, and there's plenty of blame to go around, but certainly there's been a large attempt by the current administration to minimize the impact of the disease.
Yeah.
We had the president saying, "Oh, it's just a cold." And then the president made a comment that it was a foreign virus. But as far as I know, the data show there's no predilection for this by this virus for any particular ethnic group or gender. And even for age, the impact is higher on older people, but it infects everybody equally.
Yeah, right. I mean, I read a lot of articles about restaurants that used to be filled with waiting lines now barely have, customers.
When you have Jesse Waters on Fox News saying that the outbreak is because Chinese people eat raw bats and snakes, and that their people are desperate and it's all due to that. And those comments were condemned by a lot of people, including other colleagues on Fox News, but yet that perpetuates the stereotype that this is somehow this barbaric people who are other and, and they're not civilized.
Well, people already think of us as foreigners. I mean, wherever I go, sometimes people wonder if I really am from this country. And, in my case, I wasn't born here, but I've been here most of my life. In the case of your wife, she was born here.
Exactly.
So, this whole idea that we're foreigners, with all of this going on, is not a good thing.
Look, my grandparents came from Eastern Europe. Unless you're Native American, you probably came from somewhere else.
Yeah. So is there any validity to people's fears of being around Asian Americans?
As I said, to my knowledge, there are no data that demonstrate that Asians are any more likely to be infected. There are very clearly defined risk categories that you can find on the CDC website. And certainly we know most of them, right? That's known exposure to people who have the disease or travel to the high-risk areas. And now Europe, all of Europe, is a level 3 high-risk area according to the CDC.
Right.
So this is a global disease and anybody could have it. And there are going to be dramatic changes in our society over the next few months if we want to contain this epidemic. But it's not about Asians.
It's not about Asians.
The vice president just today, Biden that is, made a speech about coronavirus, and he said, look.
The former vice president.
The former vice president made a speech, and he said, and I'm paraphrasing, but he said, look, minimizing this or spreading disinformation will only hurt us and enable the spread of the virus. But neither should we resort to panic or xenophobia. And I think it's extremely well said.
But isn't that what we do when we're afraid? We have to find someone to blame for our fears, right? I mean,
of course,
that's just
you're absolutely right. It's human nature,
right?
And you mentioned the fact that Asians look different, and throughout our history, there have been instances of scapegoating Asians because they look different.
Right.
Lots of people come from other countries, but they're not.
But we stand out.
Exactly.
Right. Which brings us back to, the Japanese internment. I mean, if you
We did not intern
people who
Italian Americans or German Americans.
Right.
To my knowledge of, and I've read a little bit on this, that there were no recorded instances of Japanese treachery, but there were many instances of German treachery and sabotage by the German-American Bund, but we didn't put those people in internment camps.
Right, so we put 120,000 because we can actually pick them out.
Exactly.
Right, yeah, it's really a challenge. I mean, I have to say there's a slight bit of worry because I've been reading quite a few articles about how Chinese Americans have been impacted. Someone was punched in the face. Customers were very politely asked not to come into this restaurant. Could they go to another restaurant to eat? If you they think maybe I should be wearing a face mask. I mean, this is really very humiliating.
Well, let's talk about face masks for a minute since you mentioned it. Face masks do nothing to prevent you from being infected. These are viruses. They're smaller than bacteria. If someone is coughing, they should put on a face mask to keep their respiratory secretions from being spread all over the room.
Yeah.
But you as an asymptomatic individual, a mask is not going to benefit you.
Right.
The only kind of masks that really do help are the very specialized masks. And we're in big trouble because we're in very short supply for all this personal protective equipment because we pretended this wasn't a problem.
Yeah, right. Do you believe that irresponsible coverage of the virus has something to do with the increase in some of this hate crime activities?
As Vice President Biden said, fear-mongering, sensationalizing this, resorting to panic and xenophobia is not the answer.
So what can we do? What can the media do?
Well,
I mean, they do have to report.
of course they have to report, but they have to report responsibly, and they need to report based on science, not on fear and not on fake news.
Mm-hmm. So what can we do to be proactive?
Well, if you look, there's lots of reliable information out there. The CDC website has a very, very useful website that's got lots of information at every level, from healthcare practitioners to lay people.
Right, right. I know the news has actually brought in people to, to present
but I
the
think
facts.
it's important that everybody be educated about this. And if you hear somebody saying what you think is nonsense, say, you know what? I was on the CDC website, and that's just not true.
Right, right. So just as a last question, we're living in a global society, and people are traveling here and there. How do you work through these obvious challenges of people going everywhere and interacting?
Well, that's exactly the point, and
that's a big
why
difference between,
we have to base what we do on facts and science.
Mm-hmm.
And if 2 or 3 months ago the administration had said, you know what, this has the potential to be a real problem,
right?
And instead of worrying about the health of the cruise industry, worrying about the health of the American population, we could have nipped this in the bud.
Yeah. Well, it's all about leadership.
Exactly.
Well, thank you, Victor, for filling in and for sharing your
really my pleasure.
expertise on this pandemic issue. That's it for our show today. Thanks to my guests, Isabel Tom and Dr. Victor Sloan, for joining me. Thanks to all of you for tuning in. Stay well, and we'll see you next time.